Dr. Rochelle Walensky has resigned as head of the CDC. This move doesn't come as a complete surprise considering her tumultuous reign as the director for the organization, considering all the missteps and outright lies that she espoused to the public during her leadership run. Well, that, my friends, is going to be the subject of today's episode. And so from Trial Site News, I am Adrian, and our episode is starting right now. So, Dr. Rochelle Walensky, the head of the Centers for Disease Control and Prevention, has resigned. Her departure has come days before the Biden administration's declared end to the COVID health emergency. In a resignation letter to the president, Walensky gave no specific reason for her departure, but said the country was in a moment of transition as the COVID emergency declarations are ending. No interim director was yet named, and Walensky will leave the CDC on June 30th. Dr. Walensky wrote in a resignation letter that, "I have never been prouder of anything I've done in my professional career." Now, in addition to the letter to President Biden, Walensky announced her departure at a CDC staff meeting. Now, according to a New York Times story on the matter, the administration plans to end the public health emergency on May 11th, closing major programs like access to free tests that had helped sustain Americans through the worst days of the pandemic. But don't celebrate just yet, the New York Times tells their readers. Why, you see, the virus has not disappeared. It is still killing roughly 1,000 Americans each week and hospitalizing even more. The leadership vacuum arrives at a precarious time. In an agency-wide meeting, Dr. Walensky admitted to having mixed emotions about her decisions and broke down in tears, according to people who had been on a conference call with her. As Walensky was quoted as saying, "I took on this role with the goal of leaving behind the dark days of the pandemic and moving the CDC and public health into a much better and more trusted place," she said in a subsequent email to the agency staff. Something tells me that she didn't quite succeed in that goal. Anyway, resignations are not unusual in Washington, D.C., but a departure on a Friday typically indicates a desire for the news to go under the radar when people are less likely to be paying attention. Importantly, Dr. Walensky resigning from the administration comes before the anticipated departure of several members of Biden's COVID response team, including Dr. Ashish, the White House COVID-19 coordinator, who is planning to leave his position this month, and Dr. Nahid Bhadelia, a White House advisor on the global response. As of now, a new White House pandemic office has no leader or staffing. And Dr. Walensky did not respond to requests for a comment, but it was reported that she had grown tired of harassment from members of the public because of the onerous pandemic restrictions and theft of personal freedoms, as well as her commute from her home in Massachusetts to the CDC's main office in Atlanta, Georgia. Now, according to the New York Times article, Andy Slavitt, a key advisor on the White House COVID-19 team in 2021, had praised Dr. Walensky's efforts to do her job, saying that it's easy to criticize and tough to do. You show up in an emergency status with a specific job to do. It's almost like a mission with a beginning and end. Even though she was running an agency during wartime is different than running an agency during peacetime. Now, before Dr. Walensky was brought on board as the CDC director, she had led the Infectious Diseases Division at Massachusetts General Hospital. However, considering she had little experience in leading large institutions and with the CDC staffing around 11,000 people, she was a surprise and perhaps odd choice to head the CDC. She was rightfully criticized for her mistakes, from making statements that just aren't true, such as vaccinated people cannot transmit the virus, which was an egregious lie, or, if we want to be charitable, mistake, not to mention the CDC's shifting positions on mask guidance under her leadership. Now, to be fair, she was also given a deeply difficult task of trying to restore the reputation of an agency that had completely botched the response to the pandemic. Remember their testing debacle? I sure do. Suffice it to say, the CDC's reputation was so battered that last summer, Dr. Walensky sought to reorganize the organization, acknowledging the agency's performance did not reliably meet expectations during the pandemic. But then the good doctor would go on to make her own mistakes, and she was rightfully criticized for her faith in the COVID vaccine without taking into account that the shot efficacy wanes. She was also criticized by Republicans in Congress for confusing public health messaging, which did not help end the pandemic and further eroded the trust in government. Walensky also faced backlash over the CDC's COVID public health guidance, which was criticized by both those who felt the agency wasn't doing enough to protect the public and those who felt it was doing too much and overstepping its mandate. The New York Times, in their article, reported that during her time at the CDC, Dr. Walensky noted the agency administered more than 670 million COVID-19 vaccine doses and provided guidance on immunization, social distancing, and masking that, quote, protected the country and the world from the greatest infectious disease threat we have seen in over 100 years. Which is a laughably absurd statement. Protected? The vaccines have their waning immunity, which means those that are vaccinated still are at risk over time. And then we had the constant lockdowns, which some critics have argued gained nothing in the end as they only ended up prolonging the pandemic, as people continued to get infected in waves rather than achieving herd immunity early on in the pandemic. And now here we are, 3 years later, new mutations of the virus on the horizon, and people are still being infected. So much for the hyped stopping the spread narrative that the government espoused. And speaking of waning immunity, researchers affiliated with Northern Italian academic medical centers in Trento and Milan analyzed 40 studies in a systemic meta-analysis chronicling vaccination status and subsequent COVID-19 infection confirmed by standard testing. They covered periods during the circulation of both the Delta and Omicron variants, and the study was published in the peer-reviewed journal JAMA Network. On average, vaccine effectiveness after 30 days was 53% when it comes to protection against symptomatic COVID-19. This was regardless of COVID-19 vaccine, whether the mRNA vaccines, Pfizer, BioNTech, or Moderna, or both COVID-19 shots from AstraZeneca or Sinovac. The researchers reported that the investigators did detect variances among different vaccines. For example, on the higher end of performance, Moderna's mRNA shot averaged 62% effective against symptomatic disease 30 days after vaccination. That performance waned considerably when comparing it to the Sinovac vaccine performance, which was only 32% after 30 days. After 6 months, vaccine performance is abhorrent, equaling 14% on average for all the vaccines, dropping even further to 9% after just 9 months. Not surprisingly, the durability of the vaccines worsened during the Omicron stage versus the time when Delta was predominantly in circulation. Now, this meta-analysis also revealed that the administration of a booster dose of COVID-19 vaccine did surge protection again to primary vaccination levels, meaning 60% at 30 days, but unfortunately and not surprisingly, this protection degraded rapidly, meaning you're back down to 13% at 9 months. It is also worth noting here that the study does include numerous limitations. For example, the study team didn't look into levels of protection associated with severe disease, hospitalization, and death associated with COVID-19. And we here at TrialSite News have reviewed numerous studies, and according to the studies we've looked at, the COVID vaccines tend to perform somewhat better for longer periods of time against more serious severe cases, but their performance does wane as well. In any case, sent back to Walensky and her resignation at this point in time also makes it easier for President Biden to appoint a new head of the CDC without worrying about a confirmation battle with Congress before the 2024 election, which perhaps is the real reason for Dr. Walensky's under-the-radar Friday departure. Either way, though, I'm personally not sorry to see the good doctor go, and perhaps we'll find someone who's more competent and does a better job. I suppose we're going to find out in the future. And that, my friends, will bring our episode to a close once more. For more content like this, be sure to check back to this channel daily, Monday through Friday, or for written articles published every day, feel free to visit us at trialsitenews.com. And as always, my friends, thank you so much for joining me on the program today. From TrialSite News, I am Adrian, and I will see you all